so this is a timely topic, and it's not a new topic, however, especially in terms of depression and suicide. These entities go way back. Burnout is a relatively new concept, and somewhat of a very helpful concept because it implies this mismatch between the worker and the workplace environment. And my presentation is on specifically interventions to help with burnout. They can be divided into really those interventions that target the individual, could be in a group setting, could be an individual setting, could be online, for example, and then other sort of high-level interventions that are more structural or organizational type. They've been randomized studies, observational cohort studies, etc. However, there are many limitations to these studies. For example, the outcomes that are measured, the populations. Some of the populations are symptomatic, some of them aren't, some of them are prevention studies, etc. So we actually have a fair amount of data that a lot of it is positive, and some very pertinent systematic reviews and meta-analyses have shown good benefit for physician populations in terms of reducing stress, reducing burnout. However, as one can imagine, implementing these sorts of studies really requires sort of an approach that's sort of driven by quality initiatives, in that we need to work with administrators, go back, assess what's been done, agree on outcomes, and really give the physicians a sense of a locus of control in terms of monitoring issues like burnout. So there's some very good consensus papers highlighting really specific issues that maybe haven't been studied necessarily, but make very good sense in terms of protecting physician health. For example, asking probing questions about mental health on licensure exams, also the EMR, the EHR that we all work with. The idea of operability has been neglected. Meaningful use has reduced patient errors or prescribing errors, etc. But looking at the burden that physicians face when using the EHR needs a lot of work. There are very good ideas about using third-party vendors to help with apps, perhaps, that could sort of enhance the workflow, because a lot of the technology seems very complicated and somewhat out of date from the user perspective, right? Other things such as leadership and hiring chief wellness officers and things like that, because it's really, we want to enhance that workplace alignment so that physicians can become more engaged in their work. There are significant implications to not having an engaged workforce. The average price for physician turnover, physicians leaving practice, is upwards of $1 million. Or more, actually. And so the price that patients pay in terms of medical errors, etc. So you can really see the rationale in terms of enhancing these things. The other topic is let's make it specific for oncology. Of course, there's certain things that oncologists deal with that are a little bit different than other physicians, and some of the individualized interventions can kind of target some of those specific issues for oncologists. So with that, I think that there's a lot of hope, actually, moving forward. I think there's a lot of interest from organizations, administrators, etc., to move forward to help us basically do our jobs better. The immediate pushback would be I think we've all heard about interventions, and I think the immediate question, interventions that take a lot of time and effort, dedicating 3 hours a week to do some sort of, it's not realistic necessarily. So I think what's interesting, if you dig into the data, you can find actually more simple interventions. Part of physician wellness, the onus is on the physician. I mean, that's just an obvious thing, right? And so some of this can be helpful, and I think doctors have, want to be well, of course, right? But the other onus is really on the organizations, okay? So to either provide that time, and in fact, a lot of the interventions, I would say, are simple things. They're simple maneuvers to change workflow in terms of timing, or in terms of giving the physician just a little bit more of a free time to basically explore their own interests, for example, do research, do other administrative tasks, things that give them meaning. The problem is that we may be working so hard that that sense of meaning becomes is lost. And so again, there's not one size fits all. There's not a specific answer, but I would say that the secret is in working together, and that's what I've seen that's what I've gleaned from the data, in other words.